Ultrachopper, new era in cataract surgery. In the beginning, everything was darkness. Storms, thunders and lightning flashes crossed the space and the oceans. They were shaken by turbulent currents that made it impossible to think that someday there would be tranquility. From the sidereal space, a ray arose that went through the firmament and like a meteorite impacted, reaching the ocean depths. And as if by magic, the stormy waters calmed. A new technology had arrived in order to bring serenity to the turbulent waters of the ocean. From that day on, everything was tranquility. Nothing would be equal. This new technology is the Ultrachopper system. It is the phacoemulsification needle flattened on its tip, angulated with a downward bend, thinner in the inferior portion, internally hollowed with two aspiration pores placed laterally. It is attached to the phacoemulsification handpiece and therefore it generates ultrasonic vibrations in position 3 of the foot pedal, behaving like a true ultrasonic knife. With a standard phaco machine, it will have a coaxial movement, but if connected to the Osul handpiece, it will show lateral motion, allowing simultaneously cut and separate the cataract material before its emulsification. This process is done by the Ultrachopper without pushing the cataract, protecting structures like the posterior capsule and sonules. Here we can see how Ultrachopper behaves in vitro. It divides the cataract in a clean and sharp way. We can compare it to a hot knife cutting a bar of butter or chocolate. Due to its design, Ultrachopper is very safe, since it will never cut beyond the nucleus, preserving the posterior cortex and capsule. In a moderate harness cataract, surgeons will find Ultrachopper an amazingly easy option to divide the nucleus before its emulsification, as we can see in this case. Even in hard cataracts, Ultrachopper may convert a challenging case in a routine case. Since the most difficult surgical step, which is to get the fragments, will be consistently accomplished. For bimanual microincisional surgery, Ultrachopper is also very useful. Surgeons can divide the nucleus in as much as 8 fragments in an easy and safe manner. Ultrachopper makes feasible to use the aqua lace for liquefaction of hard cataracts with the technique that we have called ultraqual. Presenting small fragments to the aqua lace probe makes the surgery to flow in a very quiet way. In more than 4,000 cataract surgeries in our hands, Ultrachopper has proven to be a very surgeon-friendly device. It is easy to use. The learning curve is very short. Surgeons do not have to change their usual phaco techniques. It works in any kind of cataract and helps to preserve the zonial. In summary, this new system enormously facilitates the phacoemulsification, especially to the surgeons who begin using this technique, and substantially improves the surgical time and results of the expert ones. The Ultrachopper system has arrived to stay.